It's absolutely wrong, and the public should come out with an outcry on this. It recently came to light at a meeting of the Health Committee that private facilities with separate entrances will be provided at the new maternity and the new children's hospitals. Will you as Taoiseach give a commitment that no private medical facilities will be planned or provided at the new maternity and children's hospitals, and at the very least this House will have an opportunity to debate the issues in the report before any such facilities are provided?
The Outcry report will be published as soon as the Minister is ready to do so.
Taoiseach, I've asked a very simple question and I expected a simple answer. That's why I only spent 1.5 minutes on it, so you couldn't go on a tangent. As I said, I've asked a simple question. Will you make the Outcry report available to this House as soon as possible, like this week? It's been in the department's hands for the last number of weeks, along with the ministers, and that no private facilities will be initiated or planned at the new maternity and children's hospitals until the report is issued. We have to scrutinise this. We're talking about a national maternity hospital, a public hospital and a children's hospital into the future, that you're going to bring in a separate department, a waiting room, a reception and access to facilities within the hospitals of public laboratory and diagnostic facilities. While we haven't seen the review, and we have a Sláinte Care report that explicitly says we want to remove private from public. And I'm going to make just one point, if the last Council will allow me. When the review group was set up last October, Minister Harris told the Oireachtas Health Committee on the 3rd of October that the current mixed model is not the norm and an outlier. He said, "I'm in favour of the removal of private practice from public hospitals," and he said, "Let me be clear, because sometimes I hear myself described by my opponents wrongly in relation to this. I am in favour of the removal of private practice from public hospitals, and yet at this very minute the Crumlin Children's Hospital is saying it is going to give consultants private access to private rooms, private receptions and access to public laboratories and diagnostics. It's absolutely wrong, and the public should come out with an outcry on this.